Dr. Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Dr. Grand-Pichet, I want to move over to some questions that have come in live. There's one parent who has written in a small novel, but it's good, and I appreciate, because we always say give us lots of details. So she said, "Hi, I'm a skills user and a big fan of Dr. Grand-Pichet. Aren't we all? But welcome." And they said, "So excited to be able to ask a question during the live streaming. Hopefully my question can get picked. I'm picking it, but it's got several components to it. My boy is 20 years old. With language ability around 4 years old. He's not very responsive to his environment in the natural setting. When parents, therapists ask him questions such as, what are you watching? What time is it now, etc., he knows the answer. He is able to answer properly most of the time in the natural setting. However, when his younger sister, aunt, uncles, neighbors, friends, or parents ask him the same question and reward him later, I think I might have missed part of it, Traven, and reward him later based on the number of clicks. So I think there's something there that I missed. This doesn't result in change and he tends to click all over the place. Do you have good suggestions? Traven, I think I'm missing a piece of what you sent me.
Shannon, can you read that again? When people reward him from there on?
I think there's a section missing. So I think what she started to say here, when his younger sister, aunt, uncles, neighbors, friends, or parents ask him questions, and then it got cut off, and where it picks back up, Traven, is it says, and rewards him later based on number of clicks. So I think something got cut off, Traven, and it's like the most important part. Anyway, she does say, as soon as his therapist walks into the environment and has his younger sister ask him again, he usually will respond to the younger sister. So I think when other people are asking, he's not responding. She says, we've tried a token system and given him a token every time he responds properly to other people's questions in the natural setting, but this requires the therapist to be there with him. And during the time the therapist is not there, his responsiveness remains problematic. To fix this, okay, I see, it's mixed up. To fix this, we also have tried a self-monitoring strategy and given him a counter and allow him to click for himself every time he responds to others, even when a therapist or parent aren't there, and rewards himself later based on the number of clicks. This doesn't result in a significant change and he tends to click all over the place. Do you have any good suggestions? Okay, I think we got it. Yeah. Do you have it? I think I understand the gist of it.
I sort of get the gist of it, I think. I have a couple of suggestions here, not knowing this young man. I don't know if, so using a counter to, like a clicker to reward, whether he's doing it himself or someone else is doing it, just increases the number of utterances. It doesn't increase the quality or the content. It doesn't improve what he's saying. It just increases the utterances. So assuming that he would have memorized a few responses, things like, what's your name? How are you? How old are you? Standard responses. Those are things that he might be responding to. If his language level is 4 years old, I think we shouldn't be focusing necessarily right now on just increasing his responses. Having said that, I mean, there's another issue here as well. So I'm kind of, first thing is that what you're telling me is that your therapist gets better response level than everybody else. So that first needs to be fixed, and that's an easy thing. That's basically just the therapist spending more time with everyone else and then fading themselves out. The therapist should be able to do that. The therapist starts by giving the instruction or the question, and he responds, and then have the younger sister, let's say, reward him instead of the therapist. Then the next step is the therapist, let's say, says part of the question or is just present and helps the younger sister, but the younger sister says the question and gives the reward. And the therapist gradually then removes himself from the room. So it's a process. It doesn't happen in one or two takes. It essentially takes a while for the therapist to classically condition to the other people and then leave. And the bottom line is, what was the therapist doing that made the therapist an effective discriminative stimulus, but nobody else's? And the answer to that is probably the therapist had more consistent interaction, or had spent a lot more time with him, working on these things with him. So he realized that when this therapist is here, I have to respond. And when other people are here, they don't really force me to respond. That's pretty common. So you just need to make sure that other people, the younger sister, cousins, whoever else is in his environment, are exactly following the same procedures that the therapist was, and that the therapist is present, but gradually not helping as much, but fading themselves out of the picture. That's the first thing. But the second thing is the content of what you're doing. I'm not sure having him increase his utterances with using a counter is the most important thing for this young man right now. I think you should probably reevaluate and you can do this also through skills. I was going to say you should reevaluate what's the most important content for him right now? What are your goals for him on the bigger picture type of thing? And we do have a skills program, which is for adolescents and adults. And if you go in there and answer a lot of questions, it will help you identify a really, really good overall treatment plan that's not just language. Because when you're 20, language is very important. And by the way, you could also assist his communication by giving him a visual format to communicate with language, even though he has 4-year-old level speech. If he was to see the written word, as in typing, keyboarding, or reading, writing, it might help increase his utterances. It might help increase also the quality of his response, and the amount, the length, the detail in his response. All of that is a lot easier to teach when you're using letters, a visual stimulus or prompt. So that's another direction that your therapist can go. But I really truly feel that there are other things that you should be looking at as well. For instance, and maybe you are, things like, does he dress himself, groom himself? Is he safe? Does he know what is safe and is not safe? Does he have any particular interests, both in the area of vocational or leisure? And both of those could be expanded on, so that he has activities that he can do to stimulate his mind when he's alone, and also that he learns a type of job or vocation. As it could be something very simple, but it would be something that would give him gratification and help him feel he has succeeded. Those are very important areas. Feeding himself, meal preparation, shopping for food. I mean, there's a million things that would help make him independent, even if his vocal language remained at a 4-year level. Those other things could still continue to develop. And I always feel very strongly about helping give some level of independence or autonomy to our adults. And language, when there's such a huge difference in the chronological age and the mental age. So if the individual is 20 years old and his language level is at a 4-year level, I have a little bit of a peace of mind that at least he has an adequate level of language to express things like when he's in pain, or just when he needs something desperately. Those types of things, are the most important. And those are, as long as he's able to express those, the next kind of boost to his desire to communicate becomes much more an internal motivation, which actually, honestly, I've found with a lot of our adults, they're very motivated to socialize. They're very motivated to interact, not necessarily answering questions, but just sharing some object or item or activity or something that they like to do or that they like to talk about. So I think it would be beneficial if you were able to go on Skills. I think it's called Skills Living.
That's exactly what it's called. Yes.
Yeah,
Skills Living.
Skills Living. And once you go on there, you'll answer a lot of questions, and it'll help you develop a really broad program for him across all the different areas, language certainly being one of them. And it might even give you a lot of feedback in regards to how to help expedite the language a little bit, but other areas, so social and vocational and adaptive and self-help. I mean, there's a million different areas to be looking at.
So if you want to know more about Skills Living, and that is for individuals that are 14 years and older, and it doesn't matter like what the skill level is, because they go back to, the earliest skill level, you can call that same number, 877-975-4559. I just want to reiterate too that there's always some good news in these things, even when I'm sure it's disheartening to you that he can do it with the therapist, but he can't do it with his sister, and that weighs on us as parents. But I want to point out the good news. It means he can do it.
That's right.
He absolutely can do it. And that should give you some peace of mind. And now the people in your family have to learn how to set up the contingencies. It also means that he's got a lot on the ball. Because if you think about it, there's a lesson in skills about it. Basically, it's not called that, but it's about reading your audience, reading the room, that you don't say the same thing to your 7-year-old friend that you say to your grandmother, right? Your grandmother has different interests. He's already doing that a little bit because he knows I can't get away with that with a therapist, but I can get away with that with my sister. And if you think about it, we all do that to some extent, right?
Of course.
I have a friend that, I give terrible directions. I'm the worst person in the world to give directions because I give directions the way my brain thinks. And I'm like, okay, you go down the street and there's that gas station that's all orange, and you turn left at the gas station that's all orange. And I have one friend who just stops me and goes, what on earth are you saying? What is the name of the street? And I go, I don't know. But I know that if I'm going to give her directions, I can't get away with what I normally do to people. And people generally want to kill me when I give them directions. It's just so annoying. She's like, how can anyone, you're like, turn left at the cactus, the house with the big cactus? What are you talking about? Right? But I know I can't get away with that with her. For her, I got to look it up and know what the streets are. Your son knows that he can get away with that with family members. So they just need to get better. Go to IBT so that they can get better, and have your therapist train them too. And he will be able to do it. And that's the good news.
Hey, thanks for watching Autism Live. To subscribe, click here. And if you'd like to check out some more of our videos, click here.